All right, so health starts from mouth, and the mouth is part of the body. Health is from head to toe. I think everybody will agree with these three statements here. The problem is that everything that we do in healthcare and our health flies in the face of that. What I mean is we don't understand or treat our body like it's one unit, like our mouth is part of our body. Why then would we accept the word dental as a reason or excuse not to cover the mouth, or the most important part of our body? So dental is medical, and just because it's dental, it doesn't mean it's not medical. Hi, I'm Eric Chong, and I'm the co-founder of Health Starts From Mouth medical billing system for dentists, and the founder of upgrademypractice.com, which focuses on upgrading the admin or business side of practices to keep up with and complement the clinical ability and the unique needs of dentistry. So we have been educating and servicing dentists to get paid for the doctor portion of the work that they do, otherwise known as Medicare or medical billing, mostly with Part B. After 4 years of servicing dentists in every MAC all across the country and helping dentists successfully to complete their P10, to get certified, credentialed, and to do accurate medical billing to get paid, not just for the dental portion of their work, but the most important part of their work, and which we'll kind of talk about in the presentation. And we've seen in our own practice and others through audit. I think we're the only ones that have. So we went as far as to even change a law in one state. We lobbied to do it, and then afterwards, did it help? Maybe a little bit. But what we know for sure is that what we did before works now. Before and after works just the same, meaning no laws, rules, or anything needed to be changed. We only need to work together, share what we know works, is the right way, and warn people about the wrong and the risky ways. We're confident in going direct to patient now, and strongly believe that the medical needs of the mouth are the most important and overlooked part of our health. And the reason for this training is to get as many practices on board with medical billing, because I mean the secret's out of the bag and you don't want to miss out or be left out. All right, let's get into the presentation. This is going to be about the why dental is the biggest opportunity in healthcare, and as you know, healthcare is one of the largest trends moving in the entire economy. So if you ever wanted to be in healthcare, or you're already in healthcare, and especially if you're already in dental, you're in a great spot, because the next 10 to 15 years are really looking good for you or anybody that's in dental. And we're going to be covering why dental is the biggest demand that you don't see right now, or you may not see, and why it's only going to get bigger. And by the time you realize it, it's probably going to be, well, not too late, but you just will always wish you have seen this sooner. So this has to do with health. It's something that's good for the pocket and good for the soul. If you've ever looked for a fast-moving space, somewhere where you can do a little bit less work, but just kind of ride on the wave of a trend. That's the way all smart people do it. I mean, you can work hard or you can work smart. I believe that's where that came from. So we have another training video. If you're not already on this page, you can go to milaklive.com/remote. We'll touch a little bit more on that, but the other presentation is specifically how to earn an extra $3,500 per month from home without any experience or requirements. And so the future of dental is here. There's a couple of things that I know because of my perspective and what I've been doing. But as I talk to a lot of friends, family, other dentists, other professionals out there, I realize not too many people are doing what I'm doing. I was very fortunate to make it through COVID and have a very thriving business that was growing and in very high demand. But it wasn't the case for a lot of other people. And as this is growing, I wanted to share this opportunity with as many other people. And if you've been looking for a way to, again, you make more money for your practice or supplement your income on the side, even from home, all you need is just a laptop and a smartphone these days. And that's the incredible thing. Everybody I think knows about like Zoom or video conferencing these days. So that's all you need is internet connection and the ability to talk, and communicate to other doctors and patients, and you're set. You can really work from anywhere and make your schedule on your own time. The reason why I say dental is because everybody knows the medical and health care arena, if you will. The entire area, if you combine it all, is 1.1 reaching $1.2 trillion. Now that's a huge number, I think we'll all agree. But the thing is dental is 178 billion of it. But you're going to see why in the next slide and then throughout the presentation that dental is poised to be the largest segment of the medical space, and it may even take up a majority share, right? And that's what we want to get ready for, because if we're talking about a shift to like 500, a $500 billion or more, that's something that you probably want to pay attention to. So the largest trends that we see going on in the world and in business is everything's moving towards convenience. People don't want to work as hard anymore. So if we can provide that convenience, but at the same time, people aren't okay with trading convenience for being sick or not being able to work. So being healthy is very important. Being able to be exercising, being able to play, being able to enjoy your day is very important. And then the third thing here is as we get more information, and especially with these increases in technology and AI, it's becoming more and more important that not just some company tells us something is good for us, that we really have somebody as our friend, somebody not necessarily in our pocket, but somebody that that can help us just maybe within the reach of our pocket, through our cell phone. There's so many apps and communication tools that we have right now, and chat, right? There's chat and all these other AIs that we can use to look up and verify. So this is what I mean. The biggest shift that we're going through, and we may not even recognize it because when I was at the front office, I know I was so busy just doing my work that I was looking at the clock to see when I would check out at the end of the day. And I get it. There wasn't enough money at the end of the day. But what I'm going to talk about here is that 70% of all heart disease and breast cancer starts in the mouth, right? And so sometimes in dentistry, we don't realize just how important or how profitable and how high demand dentistry really is. Here in this country, we spend 2.5 times more per person than any other country. And dental, or this dental industry, dentistry as we call it, it's transitioning. It's going from a dormant industry that they kind of denied or they put aside and they called just dentist, and it's now being recognized as the most important part of health and our body. So as doctors or dentists and doctors of the mouth get recognized, not just as any dentist, but they get recognized for their accomplishments and what they're able to do that no other doctor is able to do. As 70% of all heart disease and breast cancer starts from the mouth, it's not going to be all the other MDs that they're going to go to. And we already see, if we regularly go to a dental office 2 times a year, but most people don't. So what do you think is going to happen as this shifts? As healthcare starts to include dental, or not dental, but teeth. They're going to start to include teeth into the medical realm, and they're going to include all the rest of the mouth. We all know it. We all know it's skipped over, but it's going to happen. And my question is where do you want to be when that happens? All right, so I want to share a story of just a couple of patient cases that really show or bring to light and illustrate just how big of a demand this is, and how you watching this, you have the choice to be the solution. And really, there's not too many people that are working on this, and the demand is huge. There's about 36,000 patients, just like Nancy, every day that are turning on to the largest benefit that promises them their health, which is Medicare here in the US, but doesn't do its justice because it skips over the most important part, right? So for Nancy here, and we changed all the names just to protect the patients. But for Nancy, she fell and broke her front teeth. She got a gash in her lip, and when she was presented at the office, when she came in, she was wearing a mask to and this was years ago. This is before any of this last 3 years. She was wearing a mask because she was hurt, in pain, and she was embarrassed. She didn't want to show that she had chipped teeth on her fronts. So the ER, when she went there immediately after the accident, they couldn't help her, or they didn't help her. They don't have any dentists on staff at most ERs, which, goodness, that's a whole different subject, and we'll get into in a different video. But most hospitals and most ERs don't have dentists on staff. And so they just gave her antibiotics and sent her on her way. They couldn't really do much other than give her some painkillers. So she went to one dentist after another, and they quoted her, 10K, 12K, some of them up to like 15K. I'm sure she could come up with the money, but at the time she was saying that she couldn't, and we found out later that she could. That's what I mean. But point is she couldn't afford it, and she wouldn't afford it. So she was in a situation where she was going back to the hospital to refill her scripts while looking for a dental practice that would help her, with all of her mouth situation, all of the medical and health things that happened. And 3 months later, she started to develop a stomach infection. And literally, she's so lucky that she found us and this health starts from mouth, system and way of doing administrative for dental. So long story short, we share the story in more detail in other videos. So just long story short, she got the dentures. She was able to use her Medicare Part B benefits to cover the infection removal and the surgery portion below the gum line or above the gum line, depending on which arch. And it covered the surgery and the medically necessary or the health related portion of the treatment. And then I think in this case, all she had to do was pay for the dentures, because as we know, Medicare doesn't cover dentures. But instead of 10K, it was less than 1,000. I think it was like about $800. So this was great for her, and I might even say life saving and definitely life changing. Without coming into our dental practice and without being able to talk to Mila and this system of being able to do billing, she really would have ended up back in an ER again because of the stomach infection. We just caught her at just the right time. And it's not the dental that makes all of the medical or the patient not matter, right? So just because it's dental work or done by a dentist, it doesn't mean that we forget about the medical need or the health reasons first. So that's what we just want to say on that one. We had a Miss Kim, and this was this was actually my grandma. And I say that she paid almost $5,000 out of pocket. We already got about $600 back. What happened is she saw a dentist, and I didn't ask her about her dental, and I had been so focused on helping dentists with this. This story and this conversation is one of the major reasons why we're actually helping now with remote billing, and we really want to go direct to patient. So we'll talk about that here in a bit. But for my grandma, she almost paid $5,000 out of pocket for an implant. But this is all money that she didn't have to pay, or at least most of it she didn't have to pay. So we already got about $600 back, and we're going to be submitting the rest for reimbursement. There was two different visits that she had. She had one visit that was $3,500, and I think we'll be able to recoup or get about $5,000 or $6,000 for that first visit. And then in the other visit, there was some other work done, but we already got $600 back for that, and I think we'll be able to get another I don't know, 1,000 or 1,200 back. So long story short, we're gonna actually make more by billing it the correct way than the doctor would have gotten by doing it cash, and this regularly is the case. Cash only practices are not a good way to do practice, unless again you have the waiting list and you can command the extremely high fee schedule, and and your patients are happy. If you got that going, great. But if not, and for most practices that aren't, most people can't afford it, so it just becomes cost prohibitive. Oh, and Dr. Z. So this is for the dentist side, and just to introduce this a little bit, he was an admin consulting client and asked for an increase in sales and new patients. But sometimes like medical billing or, even adding in more new patients, sometimes that's not the first thing that needs to be done. So after, looking into the practice, it turned out that the first thing that we needed to do was make sure he got paid for, the work that he was already doing. So it comes back to dental billing, right? And I truly don't get the dentists that say that they don't take insurance. If you're getting started with those offices or you're in one now, you probably won't be by the time you finish this presentation. And we can show dentists, even the ones that say that they don't, how this makes sense. I mean, for this doctor, he had someone working in his office for 30 years in dental, and they didn't ever even think to try these codes or to get paid, the doctor paid or themselves paid. So what we're talking about is $150 per visit for like an exam and hygiene. It turned into just $210, additional $60 with just one code. And that was just one code that we tried. When we added our full health starts from the mouth system, so we went through and completely billed accurately everything that happened during the visit, and we did it the right way, the total jumped up to 641 for that one visit in exam and hygiene. So imagine how happy that dentist was. I mean, that dentist was excited. But imagine how happy the dentist that you work with will be for adding an additional $491, not just once, but every single visit that they have, in this case. So what does that mean for you watching this? What I'd like to show is, and this isn't a promise, but it's just showing what's possible. Because when I first met Mila, she was the first biller and health plan. I mean, there's other people that do it too. So there's a lot of people in practices, but I really think that we're one of the first that did it, not just for our practices, but we started to train and teach other practices how to do it as well. So we did it as a service, but we also trained other people how to really do it, because we didn't see this as something that we wanted to keep a secret. So just like I told you in the last 3 slides or those last 3 stories, this wasn't possible, and none of it was possible without Mila K and the Health Starts From Mouth system. So with Mila K, you get not just any biller, you get a medical biller, because unlike dental billing, medical billing is one of those areas that you do need to go to classes and get certified for. When Mila got her credentialing, by the way, there was her and about 400 other billers that were getting credentialed, and even the proctor of the exam thought that she was out of place. Now, that's so funny. Looking back at the time, it was very intimidating and challenging, and there was a lot of doubt to even know if she was in the right place. But then even in dentistry, it's the same way, and we get the opposite, right? And in dentistry, I make a phone call, and if I could even have a nickel for how many times I heard an office manager say, after I asked them, oh, do you take Medicare or do you take any medical plans? And they reply back overwhelmingly, a lot more than you'd think, with, oh, we're just a dental practice, or we are a dental practice. You know that, right? As if something is dental, that automatically deletes all of the medical, like we talked about, right? Which we know isn't the case. These things can overlap, and you can have something that's dental and medical. So Mila is one of the people that helped to navigate that, and the thing that she really did is to make this more known. So when she was doing it part-time with just a handful of doctors, before I met her and before we built this software that we were working on, she literally just did it through emails and through a laptop and smartphone. And that's why I'm so confident. I say 3,500 is just such a conservative number. And at the time she was a single mom raising two kids, and operating a dental practice, full time. But she was able to earn the 70K working part-time outside of that. And that's what's pretty incredible. So she was able to help patients get the dental care by providing these remote admin services that we're going to be talking about. And it helped the patient not only get paid, but it also helped the dentist get more patients. So this is a win-win for healthcare, and for you. For you as someone that is looking at this as an opportunity, and for you as someone as a patient. It's very rare that you get a win-win-win opportunity for everybody all around, but this really truly is a win. It's even a win for the insurance companies, because it's really it's in their best interest to pay less. And instead of thinking dental is paying more, it's a lot easier and cheaper to pay for dentistry, and a lot less invasive to get dental work done that solves the root cause, than having to go through like heart disease treatment, chemotherapy, and heart surgery, brain surgery, or much more other stuff. So what is this all about? The big opportunity that we see here, and the convergence of the trends that we talked about in the beginning of this presentation, is this dental industry, but not just any part. I mean, I'm not telling everybody to go be a dentist or go be a hygienist. I think that they all had their time, and for the people out there that are still happy doing that, great. But I think the next biggest opportunity that's going to be coming up, and it's there in the statistics, it's there in the trends, and I already see a lot of practices transitioning, is where you don't have to completely do away with the front office, but where they have an option, and where experts, people that are trained and people that really know this stuff, because Mila was 1 out of 400, and this is talking about a highly trained room. It doesn't make sense that patients get less than standard of care, or less than like subpar care, just because a practice doesn't know or is trying to do everything inside the practice all themselves. This really is a world where we can leverage, outsource, and delegate, and even have AI and softwares and systems come in, platforms that really help take the heavy lifting off of our shoulders. It just wasn't available until now. It didn't really make sense for dentistry, and that's why I'm so excited about this. It's basically to take care of the people that care for others. It's not just about the money, although we're in business, and so we need to look at it being profitable. And so it's good to be in an industry that is one of the highest revenue, but then also is directly dealing with the patient. So what we're talking about is dental and medical billing for the dental procedures, which ultimately allows patients to not just get their health planning done, but perform, or take action on their health plan and actually realize it, like actually experience it, and really help these practices grow. A lot of times they're spending money, and staff are just not best served in their position. So you can help dental practices be more efficient And if you're already in a dental practice and you have these skill sets, maybe there's other dental practices that really, really could use your help. So the fundamental skills that you need to do this kind of stuff, you don't need to know all three. Even if you have any one of these things, you can do really well. But if you have all three of these areas, you're going to just knock it out of the park. So dental billing, just a quick overview. Most people know what it is, but it's just the billing of dental procedures. So any work that you get done at a dental office, but the way I'll explain it is it's billing the stuff that cannot, so any of the procedures that cannot or does not have a medical or health related component to it. And I think as you really think this through, you're going to find out that number of instances or situations really dies down a lot. When I first did this medical billing, I thought medical billing was just one or two or a couple cases out of a bunch. But now I'm looking at the numbers and I realize, especially in 65 and older, about 9 out of 10 patients have some kind of medical need. So billing for procedures that don't qualify for medical first, and then understanding how dental treatment works and how they get paid for dentists. So that's understanding how the payers and how the reimbursement system works. They call it insurance, but I think we can all agree it's not. But the point is that it's really important to know how the patients get covered, so that way you can set up a winning strategy for dental billing. And so we have a lot of training on that, and I didn't realize that we did it in such a unique way. Of course, if you just focus on the money part of it, I think we get more than any other dental practice that I've seen do it. And I'm going to continue to talk to other billing companies because I'm all about raising the ship. They say, rising tide raises the ship. So I'm going to educate everybody from patients to other practices to even other billers. I just want to make sure that we all not just make the money that we all deserve, but patients get the care. Because for me, every dollar that we don't get a patient covered or we don't get a doctor paid is standard of care lost, and a patient that cannot accept treatment, it might be because of just a few dollars. All right, so in the medical billing segment, that's the second most fundamental skill. I would argue that this is more important than dental billing for patients and for the dental practice. Not just, again, because of the money, but because the patients are living. So as long as you're working on living patients and their heart is still beating, getting the dentist paid for the health of the medical portion is the key. Not just so they can accept treatment, as I've said, but just so they understand and they can navigate the entire rest of the healthcare system in the right order. Because if the front gate and the dental offices deny patients or tell them, oh, Medicare doesn't cover dental, and then stop there without explaining the rest, then it is very confusing. Yeah, Medicare may not cover dental, but they do cover the medical or the health related portion of the mouth. And the dentist or an oral surgeon is the only one that can do this work, right? And so that's what it gets into health planning, is sharing that information. It involves patient education on top of creating a plan and a strategy for patients. But it's advocacy too. So it's helping a patient to realize their best health in an affordable way, but providing them all their options. If they want to spend the money, great. So it's providing them all of their treatment options, but the important part, it's planning for the benefit of the patient and not just for a hospital, a plan provider, or somebody else that's hired basically to make money off of them. For the first time, the patient has someone that is hired by and or working for the benefit of the patient, right? So it sounds like such a simple concept, but it really is something that we need to see a lot more of. All right, so what I heard, and so don't let this shock you, and I don't want this to be confusing when I say dentistry is dead. You see it on the screen, but it doesn't mean dentists or dentistry or dental work or the demand in dental is going away. In fact, it's more now than ever. But the reason why I'm making this distinction is because the old ways of doing dental is gone. The old ways of just taking cash for dental insurance, trying to skirt by and not use any insurance at all, that's really selfish of dentists. I'm going to be honest. That's just my opinion about it. If you disagree or you have a different perspective on it, happy and open to debate. I'm happy to hear you out. But at the end of the day, it is for the patient first. That's how we should run a practice, or at least what the good practices do, and that's how I judge. If I'm a patient, I'm gonna choose a doctor or a practice that treats me not as a number, but as a human and as a patient. So the future of dentistry is here. We don't just have flying cars. We do have the future here in dentistry, and it's amazing the stuff that you're able to do now. I mean, with teledentistry, remember in the last 3 years, the biggest thing I have to be thankful for is we can actually go across state lines now, teledental and telehealth, and we can actually help people in other states. And the demand for patient care and health planners to help them, it's really skyrocketing. It's higher than ever before. And this is why I truly believe all of the other areas which they keep spending money on, like 2.5 times more, but they're not getting a result, and so that's why they keep spending. All of those areas are going to start to eliminate or reduce as people start realizing that and watching videos like this, and people start getting educated that health really does start in the mouth, and health really is simple. So yeah, all right, so we'll just move on. What is health planning? The goal, again, in this entire segment to do the admin work is to educate, facilitate, and assist people and patients in planning their best health for the person, and not just the practice provider, payer, plan, or facility. That is the goal, and trust me when I say when you make that your goal, the money, the reviews, the reputation, and the patients that will refer you more patients on patients will never end. And that's what it's all about. What is health planning? It's a process to discover the person or patient's fundamental needs in their health, and they're experts at understanding and navigating affordable healthcare and providing healthcare options. Health planners work directly with a person or patient wanting to plan, consider options, and improve the level of care for their health. All right, so the big reveal, if I will, that we're going to be doing, there's two major things that we do. And one of them is health planning, and the other one is the administrative, like, billing component. I mean, there's a lot of other components to billing, but what we like to focus on is the health planning and the billing component. So what we've done is we've actually created a pre-dental check. You can create one for yourself. If you'd like to see ours, reach out to us and I can show you what we've done to ours, and we can even license it however you feel like. But again, this isn't anything complicated. What we found is this is a great way to supplement a practice, and so this is something that we can implement into practices as well. The idea here is this. You don't need to go to a dental office most times, especially as a patient or as a person. If you don't know what you're going to the dental office for, you may end up at the wrong office or the wrong specialty. So it makes much more sense to get a little bit of research done and a better understanding. And what better place to go, instead of going to a doctor or a dentist directly and them charging you a couple $100 to visit them and get an x-ray, what we can do is you can get a health plan complete with all of your options from somebody that not just understands your mouth because they took the time to look into it, but is also a dental professional and can help you use your medical benefits to get work done in the mouth, and also help you get referred to a dentist. I mean, this really is the missing piece, I believe, of healthcare. And doing a pre-dental check allows you to kind of, as a health planner, to help patients, whether it's before going to a dental office or before the actual treatment. That's why we call it pre-dental. It's pre-dental treatment or pre-dental visit. But it's another tool, it's another resource, and it's another way that you can help dental practices and patients be healthier and more profitable. All right, so on to dental and medical billing. This is the where the rubber meets the road, if you will. This is where all the money comes about. And so it's about helping patients to not overpay, to pay twice for something, especially if they already have dental insurance, and to pay for something that their health and or their dental plan promised to cover them. So basically just helping them reduce their bill, right? And be smart about it. As dental professionals and as health planners, this is something that is easy when you know and have been trained the right way. But so many office managers and so many practices I go to, 9 out of 10, more than 9 out of 10 that I call are still doing it the old way. So, learn the health starts from mouth system, learn the health starts from mouth way. And this way you can optimize coverage, you can facilitate patient access, improve patient care, and help people get more affordable care. All right, so, the two ways that, if you find that any of this information was helpful for you, please feel free to give me some feedback. That's really the only thing that I'm going to be asking for from this presentation. There's some other resources, by the way, down below if you want to download this presentation, and then I'll have some other resources as it goes. But there's two ways. So you can, of course, you can share this information if you appreciate it, and do give me the feedback. But if you do like this information and want to move forward with it, there's two options. The first one is to take the dental billing startup. It's the first course, if you will, or it's the first step in the training, and it teaches you the fundamentals and the foundation of how to do dental billing, and it includes the exam codes. So we'll have about, I think, like 9 other exam codes. And then for health planners, or just from the dental billing startup, these are for people that already work in a dental practice, or if you already have dental clients. It's not really useful if you're not already in that setting. Health planners are more for somebody that wants to work remotely and or get hired from a dental practice. Then you can look at being a health planner. This is not just about increasing revenue and patient care, but we teach you the administrative skills and things that have really worked for us well, in our offices and as billers and health planners. And so hopefully it works for you. Well, it's been working well for a lot of people that we teach, so we trust that it will. All right, so if you want more information on the startup, and again, this is for people that are already working with dental practices or doing billing for dental practices. And then later as a health planner, you can come back and take this course. But you can find that at milaklive.com/bill. Don't let anybody tell you that you should be paying out of pocket if you have insurance, unless if they've really done their research. We really find that it's sad, unfortunate, but 80% or 90% of the time, and that's really being nice about it, but patients aren't getting their full service. It's not really anybody's fault, because the patient should do their checks too, so I'm not going to blame the office manager and the biller, but we really could be doing a much better job. And then the other option would to become a health planner, and this is if you wanted to work from home. This is if you really want to start a career in dental or dentistry, and you want to apply by going to dentalismedical.com/apply. The application is 100% free. There's no cost to apply, and you can really tap into joining and learning how to get into dentistry with the right foot and the right way, the profitable way. There's a lot of ways to do it, but we have a system that we've helped other people bill and do admin work for the last 4 years, and it's working pretty well now. So we feel like This is a great time if you want to start your career as we're launching into the patient space. Demand is bigger than ever, and I don't think it's going to die for at least the next 10 to 15 years. So as we sign off on this presentation, I will say the values that we have, and I just want to say that health starts from the mouth. The mouth is part of the body. Health is from head to toe, and don't forget that dental is medical. If you'd like my contact information, you can call or text 838-384-8366 if you have any questions or you'd like to book a call, or you have anything that you'd like to chat about in relation to this remote dental billing, health planning, or health starts from the mouth. Open to any of the topics that we've covered over this presentation. You can reach me by email. It's hp@hsfm.co. There is no M at the end of it, so it's just .co. And if you want to apply, I do urge you to apply. It's at dentalismedical.com/apply. Application is 100% free. And I'll sign off now and just wish you the best to your most profitable future. Take care, and we'll see you in the other videos.